Before your feet hit the floor this morning, something was already happening inside your body that you have no idea about. Most people think feet are just the things at the bottom of your legs. They carry you. They hurt sometimes. You put them in shoes and forget about them. But what if I told you that your feet are quietly triggering a chain reaction that is slowly damaging your knees, your hips, your lower back, your heart, and even your brain? And the worst part is, you will not feel it happening until the damage is already done. This is not about bunions or blisters. This is about something far deeper and far more dangerous. Stay with me, because what you are about to learn in the next few minutes could genuinely change the way you move, the way you sleep, and the way you age. I'm Dr. Christian O'Brien, board-certified in metabolic health and preventive medicine. In over 15 years of clinical practice, I have watched patients treat their feet like afterthoughts, and then spend years trying to undo the damage that neglect caused all the way up their body. That pattern is what drove me to make this video. Now, here is who I want you to picture for a moment. Think about someone you know, maybe yourself, who gets up in the morning and the first thing they feel is stiffness, not just in the feet, in the knees, in the hips, in the lower back. They walk to the bathroom with that shuffling, careful gait. By midday, the fatigue sets in. Not sleepy fatigue, but a deep, heavy tiredness that lives in the muscles and joints. They have tried stretching. They have tried different mattresses. They have even tried different shoes. But nothing quite fixes it. And their doctor, who is a good doctor, looks at the knee or the hip or the back in isolation, treats that one part, and never once looks down at the feet. That person is in my office every single week. And 9 times out of 10, the feet are where the story begins. Here is the first thing I need you to understand. Your feet are the foundation of your entire skeletal structure. Think about your house for a second. If the foundation shifts, even a little, the walls crack. The doors stop closing right. The roof starts to sag in places. You can patch those walls 100 times, but until you fix the foundation, the cracking keeps coming back. Your body works exactly the same way. When the arch of your foot collapses, or when your foot pronates inward, or when your toes are constantly compressed by poor footwear, that misalignment does not stay in your foot. It travels up the chain. The ankle tilts, the knee compensates, the hip rotates, the pelvis tips, the lumbar spine curves to compensate for the pelvis. And suddenly you have chronic lower back pain that no amount of physical therapy will fully resolve because nobody ever addressed the foundation. This is called kinetic chain dysfunction, and it is one of the most underdiagnosed contributors to chronic pain in adults over 50. A study published in the Journal of Orthopedic Research followed 1,200 adults over a 5-year period and found that people with uncorrected flat feet or excessive pronation were 62% more likely to develop knee osteoarthritis compared to those with normal arch function. 62%. That is not a marginal difference. That is your foot quietly writing a prescription for your future knee replacement. And here is something your orthopedic surgeon will almost never tell you. The cartilage in your knee does not regenerate once it is gone. So by the time the pain gets bad enough to bring you into a clinic, the damage is already in progress. The time to intervene is now, not when you are limping. Let me give you the second piece of this, and this one surprises almost everyone I tell it to. Your feet contain 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments. But they also contain something most people never think about: more nerve endings per square centimeter than almost any other part of your body outside of your fingertips. Your feet are sending a constant stream of sensory information to your brain. Every step you take is a neurological event. Your brain is receiving data about pressure, balance, texture, temperature, and position, and it is using that data to calibrate your posture, your coordination, and your sense of where you are in space. That last one has a medical name: proprioception, and it is extraordinarily important as you age. When proprioception degrades, which happens naturally after 50, but accelerates dramatically when feet are cramped in stiff cushioned shoes, or when the small muscles of the foot weaken from disuse, your balance suffers. Your reaction time slows. The small stabilizing adjustments your body makes hundreds of times a day become less precise, and falls become more likely. Here is why that matters so much. The CDC reports that falls are the leading cause of both fatal and non-fatal injuries in adults over 65, And a significant body of research, including work from the Harvard T.H. Chan School of Public Health, links deteriorating foot sensory function in middle age, starting as early as your 50s, to measurably increased fall risk a decade later. You do not just fall because your legs got weak. You fall because your feet stopped talking to your brain clearly. And the conversation between your feet and your brain degrades slowly, quietly, over years, while you are busy focusing on everything else. If you are finding this information useful, take a second right now to like this video. It tells me you want more content like this, and it helps other people who need this information find it. Now let's keep going, because what comes next is the part most doctors never explain. The third revelation is about something called plantar fasciitis, but I want to explain it in a way that goes far beyond just the heel pain most people associate with it. The plantar fascia is a thick band of connective tissue that runs along the bottom of your foot, from your heel to the base of your toes. Think of it like a bowstring on an archer's bow. The bow itself is the arch of your foot. The bowstring is the fascia. When that string is healthy and taut, it stores and releases energy with every step, acting as a spring that makes walking efficient and almost effortless. But when the fascia becomes inflamed, which happens through overuse, prolonged standing on hard surfaces, aging, excess body weight, or wearing shoes with no arch support, that bowstring becomes frayed and rigid. And here is what nobody tells you about that. A damaged plantar fascia does not just hurt. It changes the way you walk. Unconsciously, without even realizing it, you begin to protect the painful area. You shift your weight, you shorten your stride, you alter the timing of each step. This is called an antalgic gait pattern, a fancy term for walking funny because something hurts. And that altered walking pattern sends compensatory stress up the kinetic chain we talked about earlier, compressing joints that were not designed to bear that kind of load, in that direction, at that angle. The knee takes extra stress. The hip flexors tighten, the sacroiliac joint at the base of your spine gets torqued, and the pain that shows up in your lower back 3 months later feels completely unrelated to your foot, so nobody connects the two. A review published in Foot and Ankle International found that patients with chronic plantar fasciitis showed measurably altered gait patterns that persisted even on days when they reported low pain levels. The adaptation had become structural. The body had rewired itself around the injury. This is the moment in the video I want you to pay very close attention to, because the fourth revelation is about a connection that most people, including many physicians, completely miss. Your feet and your cardiovascular system are intimately linked, not metaphorically, physiologically. The arteries and veins that serve your feet are the farthest points in your circulatory system from your heart. They are the canary in the coal mine for vascular health. When small artery disease begins, which is one of the earliest manifestations of cardiovascular disease, it often shows up first in the feet. Decreased circulation in the feet can manifest as persistent coldness, tingling, numbness, or slow healing of even minor cuts and scrapes. A condition called peripheral artery disease, or PAD, affects over 8 million Americans, and research published in the journal Circulation found that a significant percentage of those patients had experienced foot symptoms for 2 or more years before receiving any cardiovascular diagnosis. Your feet were trying to warn you. The warning just was not recognized. And the connection goes further than circulation. Diabetic neuropathy, the nerve damage caused by chronically elevated blood sugar, attacks the feet first. The long, thin nerve fibers that serve the feet are among the first to be destroyed by the inflammation that high glucose levels cause. Numbness and tingling in the feet are among the earliest clinical signs of type 2 diabetes in millions of Americans, and again, those signals are often dismissed or attributed to something else for years. Researchers at Johns Hopkins published a study of 4,300 adults over a 12-year period and found that peripheral neuropathy symptoms in the feet preceded a formal diabetes diagnosis by an average of 3.4 years. 3.5 years of warning that went unheard. I want you to think about what that means for you. If your feet are giving you unusual signals, numbness, tingling, burning, a sensation of walking on gravel when you are not, those signals deserve a conversation with your doctor. Not a brushed-off comment. A real, focused conversation. And please, work with your own physician on any symptoms you are experiencing. What I am sharing with you today is information. not a substitute for the clinical evaluation that only your doctor can provide. Now let me tell you about a patient of mine named Robert. He was 61 years old when he first came to see me. He was a retired high school principal, active, sharp, proud of the fact that he still walked 4 miles every morning. But over the preceding 18 months, he had developed what he described as a dull engine warning light across his lower back, both knees, and his right hip. He had seen an orthopedic surgeon. He had done physical therapy twice. He had tried anti-inflammatory medications. Nothing gave him lasting relief. When I looked at his feet during his intake exam, I saw immediately what everyone else had missed. Robert had significant bilateral overpronation, both feet rolling inward aggressively with each step, combined with severely weakened intrinsic foot muscles. His arches had collapsed substantially, almost certainly over the decade since he had retired from a more sedentary job. 4 miles a day on compromised feet was not helping him. It was compounding the damage. We made 3 changes. First, custom orthotics to immediately correct the mechanical alignment. Second, a daily program of intrinsic foot strengthening exercises, which I will describe in a moment. Third, we temporarily reduced his walking distance by half and changed his surface from pavement to a softer trail. Within 6 weeks, Robert reported that his knee pain had decreased by what he estimated was 60%. Within 4 months, his lower back pain was, in his words, basically gone. His right hip stopped locking in the morning. At his 6-month follow-up, Robert told me that it felt like someone had re-leveled the foundation under the house. He had gone back to his 4 miles a day, pain-free, on better shoes, with stronger feet. Robert's story is not unusual. It repeats in my practice constantly, across different patients with different pain patterns. The feet are almost always involved. Almost nobody is looking at them. Now I want to give you something concrete and actionable because information without a path forward is just anxiety with footnotes. The first thing you can do, starting today, costs absolutely nothing. It is called short foot exercise, and it is the most effective single movement for rebuilding the intrinsic muscles of the arch. Sit in a chair with your bare foot flat on the floor. Without curling your toes, try to shorten the length of your foot by drawing the ball of your foot toward your heel. You are contracting the muscles of the arch without lifting the toes. Hold for 5 seconds. Release. 10 repetitions per foot, twice a day. Researchers at the University of Malaga conducted a 12-week study of 48 adults with flat foot and found that those who performed daily short foot exercises showed a 34% improvement in arch height and measurably better balance scores compared to the control group. A small, invisible movement that costs you nothing and can quietly begin rebuilding the foundation your entire body stands on. The second thing you can do is reassess your footwear with honest, ruthless eyes. Shoes that are too narrow at the toe box compress the toes together and prevent the natural spread that your foot needs to stabilize each step. Shoes with excessive cushioning can actually deaden the sensory feedback your foot sends to your brain, reducing proprioception. Elevated heels, even low ones of just an inch or two, chronically shorten the Achilles tendon and calf muscles over time. You do not have to wear minimalist shoes, but you do need shoes that allow your toes to spread, that do not have an aggressive heel drop, and that provide support without eliminating sensation. A consultation with a podiatrist or a sports medicine physician for a gait analysis is one of the most underused and undervalued tools in preventive health for adults over 50. The third thing is to spend time every day on uneven surfaces, not dangerous ones, a grass lawn, a gravel path, a balance board, even standing on a folded towel while you brush your teeth. When your feet encounter irregular surfaces, the hundreds of small muscles and sensory receptors in your feet are forced to activate and communicate. You are rebuilding that neurological conversation between your feet and your brain that tends to go quiet when we spend all our time on flat, hard, predictable floors. A study from the University of Toronto followed 160 older adults in a 10-week balance training program that included surface variation exercises. Those participants showed a 47% reduction in near-fall incidents compared to the control group, measured over the following 6 months. The fourth thing, and possibly the most important for those of you with diabetes or prediabetes, is daily foot inspection. Not a quick glance. A real deliberate check of the entire surface of both feet, including between the toes and along the heel. You are looking for any change, a new callus, a small sore that is slow to heal, any area of redness or unusual discoloration. Because of diabetic neuropathy, you may not feel a wound that is actively developing. Diabetic foot complications are one of the leading causes of lower limb amputation in the United States, and the majority of those cases begin with a wound that went unnoticed for too long. Early detection is the entire game. Here is what I want you to take away from everything we have covered today. Your feet are not a footnote in your health story. They are the opening chapter. They govern the mechanical integrity of every joint above them. They are one of your body's primary early warning systems for cardiovascular disease and metabolic dysfunction. They are the foundation of the neurological feedback system that keeps you upright, balanced, and safe as you age. And they are almost universally ignored by both patients and physicians until something goes badly wrong. The good news, and there is real good news here, is that feet respond well to attention. The muscles in your foot strengthen with targeted exercise just like any other muscle. The sensory pathways improve when you challenge them deliberately. Mechanical misalignments that have been building for years can be corrected with the right support and the right movement. Robert was 61 when he started. His body responded. Yours will too. You now know things that most people in their 50s and 60s will never know until they are sitting in a surgeon's office wondering how they got there. That knowledge belongs to you. Use it. If this video helped you see your own body differently today, I want to ask you to do one thing. Think of a person you love who has been quietly dealing with knee pain, hip stiffness, or chronic back trouble and has never been told to look at their feet. Share this video with them, not as a medical directive, just as an act of care. Because sometimes the most powerful thing we can do for the people we love is hand them the information that changes the question they are asking. If you have not subscribed yet, please do. Hit that button and the bell so you do not miss what is coming next, because the next video in this series covers something that connects directly to everything we just discussed. How the shoes you wore in your 40s may have already altered your spine in ways that are silently accelerating the aging of your discs. That one is going to be important. I'm Dr. Christian O'Brien, and I'll see you in the next one. Take care of yourself.